Welcome, Mike, and anybody else who will be joining us to today's event via the Library of Nazareth, to this Lunch and Learn session with Scott Yeager, who is Penny's Outreach Manager, who's going to be telling us all about Penny, which is PA's healthcare.gov replacement. So just keep in mind that this is being recorded. So if you prefer to keep your camera off, that's up to you. For purposes of sharing this recording for people who can't make it today, to get the information that Scott Yeager will be sharing with us. And without further ado, take it away.
All right. Thank you so much, Jill. And thank you to the Library of Nazareth for inviting us to present some information today about Pennsylvania's brand new health insurance exchange. We are well, it's inherent in our name. Let's start there. Most people don't know who Penny is. Our our state agency name here in Pennsylvania is the Pennsylvania Health Insurance Exchange Authority. If you say that 3 or 4 times real fast, your jaw's going to lock up on you. Not a good thing. So we decided on Penny. It's PENN for Pennsylvania, I for insurance, E for exchange. And our main goal is to help people get protected. And you're going to hear me come back to that theme again and again in this presentation, because ultimately, when we brought Penny home to the Commonwealth of Pennsylvania, we did so with a singular goal in mind. And that was to make sure that the over 607,000 uninsured in Pennsylvania actually had an opportunity and a pathway to get protected. It just so happens that we launched our health insurance exchange during what has proven to be one of the most challenging years in, I would say, all of human history with COVID-19. So that brings me to our origin. We have been around for about, as of this recording, we've been around for, as of about 9 months. Okay. Now, with that being said, I'll tell you a little bit about our history. Prior to 2019, July 2nd of 2019 is when Governor Tom Wolf signed Penny into law. But before that, we as a Commonwealth, Pennsylvania, was paying $98 million every year back to the federal government at healthcare.gov for enrollment fees that we had for customers here in Pennsylvania. So in 2019, 2018, 2019, there were a very forward-thinking group of legislators and policymakers in Harrisburg that got together, and they said, you know what? $98 million is a lot of money, and we can not only set up our own state-based replacement for healthcare.gov, we can create competition in our marketplace, which healthcare.gov was not doing. We can create a reinsurance program that will help save our customers money by regulating the insurance premiums in the individual health insurance market. And lo and behold, we were able to create our health insurance exchange, a competitive marketplace that ultimately benefits our customers. We were also able to set up a reinsurance program that helps regulate insurance premiums in Pennsylvania and protects from dramatic increases due to catastrophic losses like, a pandemic. It just so happened that the year that Penny launched was one of the most challenging here in the Commonwealth of Pennsylvania that we have ever faced. And I'm happy to report that there's a lot of good news I have to share with you here in a second. So please understand. I appreciate you taking the time to meet with us. If you're viewing this by way of a recording, I do appreciate the fact that you're spending time with us to learn a little bit more about Pennsylvania's newest agency. And with that being said, our goal, as I mentioned, is a very, very simple one. We want to make sure that people get protected. Okay. It's 2021. There is no good reason why an individual should be without health insurance protection, period. Our goal here at Penny is to work with individuals that don't qualify for Medicaid, individuals who don't have access to employer-sponsored coverage, individuals who might not qualify for Medicare yet because they're too young. And we also work with sole proprietors, small business leaders, and with small precision manufacturers. So we're here to help where there's a lot of gray area. Penny is here to shed some light on that and to make sure people have an opportunity to get protected. Not only that, but we get asked this question a lot. What's the difference between me shopping for insurance on Penny or going directly to Independence Blue Cross or Capital Blue Cross or Geisinger or UPMC or Highmark? Well, that's real easy. We are the only source for financial assistance. We can actually help reduce your monthly premium. We can actually help reduce your co-insurance, your co-payments, your deductibles, things like that, that, to be quite honest with you, scare people to death. We recognize the fact that not everybody is born with an inherent knowledge of health insurance. It just doesn't happen. So we have layers of service available that are free, that can help guide you along your way to getting protected. Our agenda is real simple. We don't work for insurance companies. Insurance companies come to us to sell their best products. We provide the marketplace where they competitively try to earn your business as a resident of the Commonwealth of Pennsylvania. So with that being said, who are we here to help? Again, we're here to help individuals who don't have access to employer-sponsored coverage. And now more than ever, there are individuals who are between jobs. There are individuals who might be working 2 and 3 part-time jobs. Even individuals that work full-time jobs may be in a position where their employer doesn't provide employer-sponsored benefits. If that's the case, we're here to help. More on that here in a minute. But we're also here to help the uninsured. In Pennsylvania, you have, again, about 607 uninsured. We're going to take a deep dive into that here in a second. But I also need to stress to everyone that we are penny.com. Think about that for a second. We're penny.com. We're not penny.gov. We're not penny.pa.gov. We're a universal resource for the Commonwealth of Pennsylvania. People have been .gov and .pa.gov to death. Health insurance and protecting your quality of life should not be a political thing. Our legislation that gave birth to us was bipartisan, unanimous. Why? Because protecting people is good for everyone in Pennsylvania. I'll get to that in a second, but we operate a no wrong door policy. So if you're an individual who is Medicaid eligible, we have a warm person-to-person transfer to help you connect with an individual to help make sure that you get the protection you need. So more on that in a second as well. But how do we help? Again, you heard me say that we have free services here at Penny. We do. Our customer service team, they're not salespeople. They're individuals who are here to help you get protected. They do not work for insurance companies. Our customer service team, and you can connect with them at 844-8040. They are unbiased, no hassle educators. They help you explore what financial assistance you qualify for. They help you explore what types of insurance plans, health and dental, that are available for you. And ultimately, they'll help you, make the best decision that you can make for yourself. As a state agency, we have online self-service because, again, we recognize not everybody likes talking on the phone. Some people prefer to, sit down at the kitchen table at 11 p.m. and after all the busyness of the day is gone, they want to sit down and they want to attend to their own business. Well, we give them the ability to do that, but we also provide education and outreach, sort of like this seminar that we're having with the Library of Nazareth. So it's important to know that you'll always have help, and we do our best to make sure that people have education. When it comes to working with individuals in your local community, Penny also has certified brokers and assisters that will help you in your local community, again, free of charge. So there are all manner of different layers of support to help you get to a place where you're protected. And if you take a look at this heat map, what this heat map represents is it represents the uninsured here in the Commonwealth of Pennsylvania. And I'll let you absorb this for a minute, but what it truly represents is about 1 in 20. Think about this for a second. 1 in 20 of our friends, our neighbors, in some cases, our family members, wake up every day. They make the decision not to be insured. Now, I am going to let that sink in for a second, but I'm also going to impress upon you the fact that within the United States of America and within the Commonwealth of Pennsylvania, the number one reason for individuals declaring bankruptcy are unmanageable health insurance bills. Again, it's 2021. There's no reason why anyone should be unprotected. Okay. The good news is that we have at Penny, we've gotten some help this year. As of March 11th of 2021, the Biden administration had actually signed in to law the American Rescue Plan. And the American Rescue Plan already took a situation where, again, if you think about Penny's legislation, it set up a competitive state-based marketplace that benefits our customers. We set up a reinsurance program that regulates the rates and premiums for our customers. There's a theme here. I hope you can see it. What the Biden administration did is it took our financial assistance, which again, Penny is the only source for financial assistance in the individual health insurance market. We're in a position right now where those financial subsidies have been enhanced in such a way where there are a lot more people who are going to qualify for assistance with us in 2021 and 2022 than had previously qualified in years past. Now, with regard to the enhanced financial assistance, the enhanced financial assistance through the American Rescue Plan is good for not only 2021, but 2022 as well. So when Penny kicks off our second open enrollment, November 1st of 2021, those enhanced subsidies will be in place to help people get protected. Now, what does that mean? That means that prior to the American Rescue Plan, there were a lot of individuals. If you made, as an individual, if you made $51,000 or more, there was a subsidy cliff, and you weren't eligible for any financial assistance after that. That's part of the reason why we set up the competition in the marketplace and set up the reinsurance program, was to help individuals that fell off of that subsidy cliff. We want to make sure that Penny's health insurance options, even if they're full price options, are still affordable and manageable by people. For a family of four, if you made $105,000 or more, you fell off of that subsidy cliff. The good news is now that subsidy cliff is capped at 8.5% of anyone's income. And I'll show you some examples as to where that really makes a difference here in a minute. Another significant thing is that we know a lot of people who have come into, through no fault of their own, they have come into workforce transition. So our friends, our neighbors, there are a lot of people in the community who are between jobs right now. For those individuals, if they fill out an application on Penny during 2021, they will be considered, if they qualified for 1 week of unemployment, regardless of whether they collected the financial benefit to the unemployment or not. If they were eligible for unemployment for at least 1 week, they can come fill out an application with Penny. There's a checkbox that checks. Once they check that box, it will automatically qualify them for the maximum amount of advanced premium tax credits that we have here at Penny. If they align with our second lowest cost silver plan, which is very, very good insurance, chances are they're going to be paying a $0 premium each month for that. So given the contrast between paying $0 a month for good health insurance or paying for Cobra benefits, which, to be quite honest with you, Penny will always be an alternative to Cobra. It's worth looking into. I'll just say that. Speaking of Cobra, under the American Rescue Plan, there was a Cobra subsidy that was established to run through April 1st of 2021 through September 30th of 2021. Well, the big question everybody has is, well, what happens to the people who get the Cobra subsidy after September 30th? It's funny. I was just on the phone this morning with a gentleman who's in that same situation. And it's frightening. Cobra is expensive. To continue your employer-sponsored benefits, it is very expensive. Most people, including the gentleman I talked to this morning, it was a choice of, okay, well, I can pay for health insurance or I can pay my mortgage. It shouldn't be that way. It shouldn't be that way. So we know, as a state-based exchange, we know that the federal government is going to end that Cobra subsidy on September 30th. So what did we do? Our board of directors here at Penny got together and they said, we're going to create a special enrollment period just for those who are going to encounter that situation where they fall off of the Cobra subsidies in September. So we opened up a special enrollment period here at Penny, started on August 2nd. That special enrollment period will go through and provide any individual who is currently on Cobra with the ability to shop for Cobra and to have those benefits set and ready to pick up where the Cobra subsidies leave off on October 1st of 2021. And again, that's part of the blessing of being a state-based exchange. They may or may not have had that option going through healthcare.gov, but because Penny's here now, we've got control. Pennsylvania's got control to help the people who live here. Speaking of which, you'll see down at the bottom there where it says COVID-19 enrollment period. We have a COVID-19 enrollment period that, as of the recording of this video, it is going to end this week, believe it or not. Because of COVID-19, our board of directors here at Penny opened up a COVID-19 enrollment period that was active February 15th of 2021 through August 15th of 2021. The great news about that is that we were able to literally literally insure thousands of people during the COVID-19 enrollment period and through the efforts of the American Rescue Plan that we normally wouldn't have been able to insure. I'll give you an example. When Penny launched on November 1st of 2021, or I'm sorry, November 1st of 2020, we had about 280,000 customers that we had migrated over from healthcare.gov. Right now, as we stand here, and I am happy to report this in early August, we're in a position where we have 335,000 customers currently here at Penny. So we grew our enrollment significantly. We're able to get more of our friends, more of our neighbors, more of the folks here in the community. About 15% of our customers are unemployed. They check that unemployed box on our Penny application, and we were able to get them protected in a time when a lot of people were looking for a lot of options. So that's why, again, we're here. I also, while we're on this slide, I want to point out that we are having our second open enrollment. It'll be on November 1st of 2021. The first deadline for January 1 coverage of 2022 is December 15th. The second deadline, and again, if you were on healthcare.gov, you would have from November 1st to December 15th, and that would be the end of that. Well, here's the good thing about being with Penny now. We have extended the deadline for 2021 coverage to January 15th. If you want to be covered by February 1st of 2022, you can apply by January 15th of 2022, and we will make sure that you have that February 1 coverage in place. So there are a lot of good things about having your own state-based exchange. And this, in terms of the American Rescue Plan, this is one of the things I wanted to make sure everybody had an opportunity to take a look at, because again, currently we have grown our enrollments to 335,000 Pennsylvanians, which is fantastic. But here's what's really good about it. Through the American Rescue Plan, about 53% of our customers pay less than $1 a month for their health insurance. 71% of our customers pay less than $50 a month for their health insurance. That is incredibly important to keep in mind. And I say this because at the end of the day, that's what we're here to do. We're here to protect people. And I have some additional scenarios that we're going to run through. And these are directly related to the American Rescue Plan here at Penny. In this example, you have an individual, he's single, he's from Philadelphia County, he makes about $20,000 a year, okay? Prior to the American Rescue Plan, for our second lowest cost silver plan, our benchmark plan at Penny, we have 3 different types of metal tiers. We have gold, silver, and bronze, all of which meet, and I'll talk about this a little bit later, but all of which meet the 10 minimum essential health requirements set forth by the ACA. In this case, you have an individual who makes about $20,000 a year. Prior to the American Rescue Plan, he would have paid about $66 every month for his health insurance. That's pretty steep for somebody who makes 20 grand a year. Now, under the American Rescue Plan, our second lowest cost silver plan, which is our benchmark plan, it's really, really good insurance. This same individual now would pay $0 a month. It saves about $800 a year. For somebody who makes 20,000, saving 800 a year, it's going to give them a little extra so that, you know, they can help with other things. But that's a starting point. Here is an incredibly significant example. And this is one that a lot of people run into, regardless of where you live in the Commonwealth of Pennsylvania. We all have friends and neighbors who did everything right. They worked hard all their life. They put themselves in a position where they could retire early, maybe by a year or two, maybe 3. In this case, you have a couple. They're 64 years old. They make about $77,000 a year in retirement. Prior to the American Rescue Plan, health insurance, if you are retired early, costs a lot of money. If you don't qualify for Medicare, Medicare options, Medicare supplements, your health insurance can cost a lot for anyone who retires early. In this case, it was about $2,462 a month that they had to shell out for their health insurance. Now, because we cap that financial assistance, and or I should say qualify that financial assistance at 8.5% of their income, we're able to offer them a monthly premium of $550 a month. That saves them about $23,000 a year. That is absolutely life altering for a couple like this. And remember, those subsidies are in place 2021 and 2022. Here's a more common scenario. You have a family of 4. This family of 4 makes about $52,000 a year. Prior to the American Rescue Plan, this family of 4 would have paid about $285 a month for their health insurance. Now they pay $87 a month. Think about that for a second. $87 a month to cover 4 people. That's a little bit more than $20 per person per month. That is phenomenal in terms of being able to help a family like that. They would save about $2,300 a year. And that's something that they could use for their family, for the children, and they would still be protected. Here's an example of an individual who is unemployed. Prior to the American Rescue Plan, if this individual, and in this scenario, she didn't qualify for employer-sponsored coverage, so she purchased her health insurance through the marketplace. It was $364 a month. Now, under the American Rescue Plan, because she's recently unemployed, because she's receiving unemployment compensation, again, she checks the box on Penny's application. And for our second lowest cost silver plan in her market, she's going to be paying $0 a month. Now, for somebody who's unemployed, saving $4,300 a year is significant. It also provides them with the ability to have the confidence that they don't have a gap in coverage. And, you know, again, I can't stress enough, Penny will always be that alternative to Cobra. Most people, when they get the Cobra letter in the mail, shortly after they're waved off of the floor with smelling salts, they start looking for alternatives. Well, Penny is that alternative. So please keep us in mind. Our customer experience, you've heard me talk about this, and I'm going to come back to, again, a point that I hit on early on, but is so significant to keep in mind. People ask all the time, what is the difference between going directly to a Capital Blue Cross or going directly to an Independence Blue Cross or a Geisinger or a UPMC or Highmark to get my health insurance? Why do I have to pay, through Penny? Well, number one, you're not paying through Penny. Number two, we're the only source for financial assistance. Okay. The only payment that will ever be charged, all of our services are free. The only payment that will ever be charged through Penny will be the initial binder payment to secure your health or dental insurance. Okay. But that goes directly to the insurance carrier. And from then on, we have your back. We've got your financial assistance that we send to them every month. But you can confidently purchase that insurance at a reduced rate. That's what matters most. We are the only source for financial assistance. Also, I have said this before, and I'm going to say it again. All of our insurance plans, bronze, silver, gold, doesn't matter. All of them meet the 10 minimum essential health benefits that are set forth by law in the Affordable Care Act. Okay, so we cover things like outpatient services, paternity or maternity, newborn care. We have rehab services, mental health services, you name it. There are a lot of advantages. And here's the best thing. We don't sell junk insurance at all. All of our insurance plans are created in such a way that if you have a pre-existing condition, you cannot be denied coverage. If you're under the age of 26 and your parents have their insurance through Penny, you can join your parents' plan. Okay. So there are a lot of really good inherent benefits. And here's another thing that I want to come back to and remind people of. Competition in the marketplace is and will always benefit our customers. So what do? We constantly encourage health insurance companies, come to Pennsylvania, sell your health insurance products, make sure that you're aligned well with our hospitals and health centers, and we add them to our list. As you see right now, we have really the 800-pound gorillas in terms of health and dental here in Pennsylvania. And that list is going to get more diverse over time. And that list is going to get so much better in terms of companies that we know have good track records in helping people protect their quality of life, because at the end of the day, that's what it's all about. Now, you've heard me say before that all of the support services here at Penny are free, 100% free. However, one of the things that I need to stress is that you can always call, no matter what. You can always call 844-844-8040, Monday through Friday, 8 to 6 p.m. And Penny's customer service representatives are there to help you. They're there to help educate you. They're there to help guide you towards making the best decision you can for yourself, for your family, and for your quality of life. Their services are free. If you would rather work with somebody directly in your community, you always have the opportunity to work with a Penny certified broker or a Penny certified assister. What's the difference? Well, a Penny certified assister typically works through a hospital, a health center, faith-based organization. They work for community organizations, and their goal is aligned much the same as our customer service representatives. They will not charge you for their services. They will not, sell you hard on insurance. Their goal is to educate you so that you make the best decision about what's right for you in your quality of life. But sometimes people come to Penny and they have very complicated situations. Well, guess what? Within the Commonwealth of Pennsylvania, the only individuals who can work with you with regard to complicated health insurance related matters, and they are the best, are Penny certified brokers. They are the only licensed insurance professionals who can make that professional recommendation for you and say, I believe based upon A, B, and C, that the best plan for you and your quality of life is this. And they can point that out to you quite literally. But please keep in mind, no matter where you are in Pennsylvania, no matter how you approach your level of service or a combination of service, everything at Penny is free. Okay. Now, as a new agency, one of the things that I try to stress to people is as of the recording of this presentation, we're about 9 months old. So you can please refer people to us. If you know somebody who needs insurance, if you know somebody who's unprotected, tell them to go to penny.com, share our customer service number with them. And you can, direct groups and individuals our way. You can also share our social media content. We're on Facebook, we're on Twitter. We have a newsroom where all of our, updates as they come through are made available. And you can also participate in our outreach and education work group. That outreach and education work group meets bi-monthly, and everyone is welcome. If you go to penny.com under support, or at the very bottom, you'll see a link where it says community partner. If you click on that link, you'll have an opportunity to join our outreach and education work group. And to be quite honest with you, the only way that Penny is ever going to get better and improve and become the health insurance exchange that Pennsylvania needs us to be is if we get feedback, because we're upfront with people. We do not claim that any of our ideas have their origin in the mind of greatness, but what we are is we're very open to feedback. We're very open to folks here in Pennsylvania and the things that they may need. What I'd like to do at this point is I would like to actually share and introduce everyone here to penny.com. Okay. Now, as you can see, we're in a position right now where we're trying to promote the fact that, Sunday, August 15th is when our COVID-19 enrollment period ends. Okay. What we try and do from penny.com, and again, we're penny.com, not gov.pa.gov. Why? Because we want to be that universal resource for folks here in Pennsylvania who don't have access to health insurance. Okay. Right from our homepage, we have instructional videos. We, have our customer service number, 844-844-8040. That's available, as well as our call center hours. That's available. Any key dates for enrollment, open enrollment, what have you, we're always going to have those available here. If you live in the region and you want to connect with a Penny certified broker or a sister, all you have to do is click here. And again, based upon your area, I'm going to put in 18064 and we'll search for brokers in your region. Right within Easton, in your area, we've got 4 Penny certified brokers that you can connect with. And again, not everybody is the type that they want to work with a broker. Some folks might want to work with an assister. So if and I'll open this up a little bit, we'll say 10 miles. If we look here, we've got the neighborhood health centers of Lehigh Valley that you can connect with. And again, the assisters are here to help, both in English and Spanish. So please understand that we are here to help. As you go down through the scenarios that we just covered for the American Rescue Plan are available here so that you can review them. We also have educational materials available. Any of our events, enrollment events, or Penny is also sponsoring the YMCA Health Equity Tour this year. Any of these events that we have planned, you can always come here to the homepage and you'll get that information right off the go. We're going to come here real quick and talk about how to shop and compare plans, but I want to stress to everybody again that you can always click to call our customer service center here. Very, very simple. You can find a broker. You can connect with a Penny assister, or you can even email us a question, because I know a lot of people, they don't have the time to, pick up the phone and call. One of the things that I feel is very important about penny.com in terms of being an accessible and universal site, if you look down here in the lower right-hand corner, you will see that you have the ability to actually translate Penny as a website into 5 different languages. These are, according to our research, these are the 5 most predominant languages that we have here in the Commonwealth of Pennsylvania so far. We have Spanish, Mandarin, Russian, Arabic, and English. So if you wanted to, and I'm just going to choose Russian, if you wanted to, transform Penny into a Russian website, you have the opportunity to do that. And what's nice about this is if you mentioned, or if you heard me before, I mentioned that, there are a lot of people who are confused and a lot of people who just don't understand the value inherent in health insurance. And why is that? Because in many cases, they may be lawfully present in the United States. They might be on a path to citizenship. They might have a green card. They might be here on a work visa or a student visa. Well, if they're here in any of those capacities, they can shop for health insurance through Penny if they don't get health insurance through work or school. Okay. It's important to be able to share this type of information to folks who might be from other countries or on a path to citizenship, because their country of origin, it might be a situation where if you get sick, you go to the doctor, you pay the doctor. If you need medicine, you go to the pharmacy, you pay the pharmacist. The idea and the concept of insurance might be something that is absolutely confusing to them. So Penny offers, at least, to some extent, we offer the ability to translate the website directly. I'm going to go back up here and focus on our call center number, the 844-844-8040 number, very quickly. Why? Because through Penny's call center, and a lot of people probably would think about this, through Penny's call center, we can also provide up to 240 different translators, language translators, to our customers. And believe me when I say that's just about every language you can think of. We have somebody who can step in and can help that individual work with one of our customer service representatives and do so in a way where they're understood, their questions are being answered appropriately. And at the end of the day, like I said, our goal is very simple. We just want to see people get protected. And that brings me to an important part of Penny's website here, and that is Get Covered. You see this big gold Get Covered button. If you click on this, this is where Penny becomes real for a lot of people. You can browse for health and dental plans. It's the very first tile you see right here. Okay. It'll take you to Penny's plan comparison tool. Now, what's nice about this is, and I have the zip code here. All that you need to do is enter 3 pieces of information. And I'm just going to make up a date of birth. You can add a spouse, you can add dependents. Anybody who is seeking coverage gets a blue check mark. Okay. You can put in a salary. As soon as you put in your annual household income, and here's an important facet to note about Penny. Education is big for us. It is a big facet of what we want to do for our customers. So anytime you see something that is underlined like this, if you hover over it, it'll tell you what it is. There are a lot of people that if you talk about, annual, tax household income, they're going to scratch their head and they're going to say, well, is that my gross income or adjusted income? What is that? Well, this will tell you exactly what it is. But over here, and this is the important factor, as soon as you, as someone who's helping a customer or somebody who is a customer of Penny, puts in their zip code, date of birth, and their annual salary, it'll say, see if you qualify for benefits. Over here, immediately, we have, before anybody looks at their health insurance options, they know what they qualify for in terms of financial assistance. Okay. And this is incredibly important for a lot of people, because let's face it, you can have the best health insurance on the planet, and if people can't afford it, you've got a boat on dry land. That's what you've got. You've got a car with no wheels. People won't use it. If they can't afford it, they won't use it because they don't understand it. But helping people pay for it it removes a lot of that anxiety. And I'll show you where I'm going with this here in a second. Through Penny, they can also list a doctor or dentist if they want to look for a specific family doctor or a specific dentist and plans that align with that. They can also, and this is what's really nice, they can, let us know, how often do you use your health insurance benefits, because there might be certain plans that'll be better aligned with you doing that and doing so affordably. That's an important thing. Next to that, do you have any ongoing monthly prescriptions? Okay, now what does that mean? Well, that's, prescriptions that you may have as maintenance medications. If you do, let us know. And if you have specific concerns about what those prescriptions are, you can actually list up to 5 different prescription drugs here that are like your top 5 prescription drugs that are a must-have under your insurance plan. With that being said, these are, in your market, these are the health insurance options that are available currently. And you see there's Capital Blue Cross, there's Oscar, and you'll see the different metal tiers. There's bronze, silver, gold. And yes, those $0 plans, those are legitimate. But you can see that there are a lot of plans that we have here, some high mark plans. The plans that we have are relatively affordable. And in your particular market, we have 52 different health insurance plans that are available. Here's the thing to point out, and I'll use this Capital Blue right here. I'll use the Capital Blue EPO. Anytime you want to take a look at the specific details, all you need to do is click on details. Okay. It will take you through what the deductibles are. It'll take you through out-of-pocket maximum. It'll take you through, what your visits would cost, your co-pays, your co-insurances, things like that. We also, through Penny, we give you the ability to compare plans. So let's compare this silver plan, this bronze plan, and this gold plan. And you'll see that they populate over here. When you hit compare now, and you can do this for yourself, you can do it for a friend, you can do it for anybody. You can show them, okay, this is, okay, well, number one, you remember I said anything that you do where you don't understand what it is, you can always hover over it. If it's underlined, you can hover over it and it'll tell you what it is. Some people might know, okay, well, an HMO is a health maintenance organization. Some people will know that. Well, what's an EPO? Well, that's an exclusive provider organization. That's a variation on a theme. So again, this is where it's important that you spend time, that people who need help spend time. Long story short, this is where you also get into some of the things that may be important, such as other special needs that people might have. And that can range from, does it, cover acupuncture? And in one case, the Capital Blue covers acupuncture, $20 copay. It's not covered under the Oscar plan. So that's important to know. But when you take a look at the other benefits that are here, it's important to be able, like for emergency room care and urgent care, what does that look like? Under urgent care, well, Capital Blue, it's a $45 copay. Under Oscar, it's $75. Okay, so that's important for people to be able to look down at the granular level on all that stuff. The last thing that I want to point out here, and it's an important factor, is you can purchase dental plans through Penny. You do not have to purchase a health insurance plan to purchase a dental plan. If you need a dental plan, you can come and shop at Penny for dental insurance. And again, what's significant about this is you can review what is significant to you in terms of a dental plan. And for a lot of people, it comes down to orthodontia. Is orthodontia covered? If you have a child who's ready for braces, that's something you definitely want to make sure that you look into. So that being said, those are the ways that people can connect with Penny. Those are the ways that we help people get and gain access to affordable coverage. Please keep in mind that our COVID-19 enrollment period ends on August 15th of 2021. However, we do have our second annual open enrollment for 2022, plan year 2022, that will open up on November 1st of 2021 and go through January 15th of 2022. The enhanced subsidies through the American Rescue Plan will be in force through 2021 and 2022. The unemployment checkbox on the Penny application, again, during 2021, we will have that available for anybody who was unemployed for at least 1 week or qualified for unemployment for at least 1 week in 2021. Regardless of whether you collected that benefit or not, we'll be here to help get you covered if you need covered. With that being said, Jill, thank you so much, and thank Nazareth Library so much for hosting us.